And as a reminder, this session is being recorded and we'll share the link with you afterwards.
People say the COVID-19 vaccine development was rushed.
Yep, works. Oh, now it doesn't.
It started in November of 2019, and the first dose of the Pfizer vaccine was given on December 8th, 2020. That's only 13 months. When the average vaccine takes 10 to 15 years to develop, how do you go from discovering a brand new virus to having such an effective vaccine in just over a year? Well, the first point is that it's not an entirely new virus. Remember SARS? That was 2002, and it was a coronavirus that we now call SARS-1, while COVID is caused by SARS-2. And as it turns out, SARS-2 is 80% identical to SARS-1. And because they started working on a coronavirus vaccine 20 years ago after SARS-1, they had a huge head start. The other point is that when this virus hit, scientists across the world basically dropped what they were doing and started working on COVID. So we had millions of really smart people all working on the same problem at the same time. The final point is money. Governments threw money at this problem like nothing before. The US government invested $18 billion in a program called, believe it or not, Operation Warp Speed. What that did was to put the risk of vaccine development onto the government instead of the pharmaceutical companies. So they started with animal studies, then they went to the usual phase 1, 2, and 3 human studies. But rather than waiting until each stage was successful, government funding meant that they could do these studies in parallel because they weren't taking on that financial risk of failure. And normally it takes time to find people even willing to participate in a trial, but in the middle of a pandemic, not an issue. So the human trials moved fast, they were positive, and then of course it moved straight to the front of the line for approval. And normally companies would wait for approval before investing in factories for manufacturing, but in this case, the government took on the risk. So the companies actually built manufacturing plants and mass produced the vaccine during the trials in the hopes that the trials would be positive. Now, it didn't work out for all the vaccines that were tested, but for the ones that were effective, this meant they could go straight from trials to distribution. And that's how they did it in 1 year. A head start, a whole lot of collaboration, and a whole lot of money. But not a single step was skipped. So, was the COVID vaccine rushed? Absolutely not. Thanks for watching. For more myth busting and science info, subscribe to the feed, and I'll see you next time.
Excellent. Thanks so much, Samir, for sharing that. And also just as a reminder to everybody, we'll make sure that you all get the link to that and the link to Samir's YouTube channel. We encourage you to have a look at that. There's lots of other great videos that you can share and related to COVID. So we'll make sure that we send that out to you later on. So next slide. So we're now going to kind of go through some questions. And at this point, we want to make sure that that we encourage all of you to vote using polls. So there's going to be some pop-ups that appear, and we're going to ask that that you participate. As we mentioned at the beginning, we don't know who's answering. We don't know who answers what. So we encourage everybody to participate. And after we pose the question, we'll give you all an opportunity to vote, and then we'll hear from one of our two experts, and they'll answer the question for us. So we'll go through a few of these questions, and then once we're finished some of these, then please consider the opportunity to submit other questions as well. So using our computers, moving on to the next slide, and we're going to give an example of how we can use this. So first of all, our first question is, the vaccines don't work against the Omicron variant. And we want you to think about, is this a fact or a fiction? So using the pop-up, so the first question, COVID vaccines don't work against the Omicron variant. So click on fact, fiction, or you also have the option of I don't know. So please vote now. And what are the answers? So can you show us the results of the poll? So 82% of you said fiction, and or faction, as I like to call it, no, fiction. So 82% said fiction, 18% said fact. So over to Anju, your answer for this one, fact or fiction?
So this is fiction. Study after study have shown us that vaccines are effective in doing what they were set out to do, which is really preventing severe outcomes from COVID. And that includes the Omicron variant. And when we're talking about severe outcomes, we're talking about things like hospitalizations, death. And recent studies show that upwards of 80%, like this is true of the Omicron variant, and there is upward of 80% vaccine effectiveness against severe illnesses with 2 doses. And that number goes above 90% with the booster dose. So booster doses help restore vaccine effectiveness, they protect against severe illness, and their safety profile is similar to second doses. So currently we do recommend that all individuals who are eligible get their booster doses 6 months after their initial COVID vaccine, or if you've had COVID and you've had your first 2 doses, you wait for 3 months after symptoms or your positive test to get your booster dose.
Great, excellent, thank you so much. So the answer to question 1 was that it was fiction. So well done, everybody. Moving on to question 2. So fact versus fiction. Omicron is mild. So the pop-up questionnaire will now appear. Option 1, this is fact. Option 2, it's fiction. Or 3, I don't know. So Omicron is mild. And we'll close the poll. %60 said fiction, 40% said fact. And the answer, Samir, next slide.
So that's fiction. A little bit of a trickier one, because I will concede that it's milder than Delta, and that's important. You know, to be fair, inherently, it's less likely to cause severe illness. It's less likely to kill people, whether you're vaccinated or not, compared to Delta. But to be fair, when you're comparing to something really severe, even though it's less severe than something very severe, doesn't make it mild. The other thing to think about is just how transmissible it is. It's 3 to 4 times more contagious than the Delta variant. And so even if you have something, let's say that's 1/3 as likely to kill someone, if 6 times as many people get it, which is about the order of magnitude with the 6th wave, twice as many people will still die. So the impact on our society, on our healthcare system, we're all feeling that impact, is still massive of the Omicron variant. The other thing with respect to the healthcare system is sort of in the earlier waves, it was often that we were there, healthcare workers were there, but there was too much demand. There were too many patients. We didn't have enough equipment, beds, et cetera. Whereas later with the 6th wave, what's been different is that society is largely vaccinated so that the severe illness is reduced. So the demand isn't as increased, but healthcare workers have often been exposed because it's so transmissible. So we've had isolation, we've had, in some cases, quarantining. And as a result of that, there have been less healthcare workers. So the supply and demand issue still was there in the 6th wave, where we still had a hard time sometimes keeping up with the patients in hospital. And the last thing I'll mention is always to keep in mind long COVID, the possibility that 15 to 20% chance of people getting long-term symptoms. Even if they don't get severe disease, there's always that possibility. So no, it's not mild.
Great, thanks so much, Samir. Moving on to question 3, fact or fiction. The vaccine is halal, kosher, and doesn't contain any meat products. So submit your vote in the poll. Option 1, this is fact. Option 2, this is fiction. 3, I don't know. So we'll give you a few seconds to vote on that one. And we'll close the poll and show the results. 100% said that this is fact. Anju?
So that is correct. That is a fact. The vaccines are halal and kosher and do not contain any animal products. And this is really important. And many different faith leaders and community groups have helped to reiterate this in various communities. We have a bunch of resources listed at the end if you're interested in more resources on this topic to share with other members of your family or community as well.
Great, excellent. Thanks, Anju. So well done, everybody. So everybody got that one right. Congratulations. Moving on to number 4. If I got my first 2 doses, I don't need to get a 3rd dose. So again, moving to the poll. First option, this is fact. Second option, this is fiction. Third is I don't know. And the question is, if I got my first 2 doses, I don't need to get a 3rd dose. So vote now. And we'll close the poll. 100% said this is fiction. Samir?
Correct. That was false. You absolutely do need to get a 3rd dose. Sort of think of it as, 3 doses is the new 2 doses. And the reason for that really is Omicron. It's kind of a perfect storm of 2 things happening at the same time. One is that anytime you get an infection or a vaccine, you get an antibody response. But over time, the number of antibodies, the concentration of antibodies in your body will drop. It'll go down. And along with that, your protection goes down a little bit. And that's a waning effect of the antibodies. So that's happening because we were early with our vaccine campaign, and many Canadians had their 2nd dose a long time ago now. At the same time, the virus has mutated. The virus has changed, and we have the Omicron variant since the end of last year, which really is quite different than previous variants. And what that means is that the vaccine is less well matched to that particular variant. And to overcome that relatively less good matching, you actually just need a very high antibody level. And studies have shown that if you can boost that antibody level to a really high level, it's still good enough to protect against Omicron, as Dr. Anand said. And that's what a booster does. That's what a 3rd dose does, is it gets your antibody levels right back up again. If you look at studies from the UK, your protection from symptomatic infection after 2 doses within a few months comes down to under 40%. You get a 3rd dose, it goes up to 75%. Your protection from severe disease is even that goes to less than 60% 6 months after your 2nd dose. And again, you get your 3rd dose and it goes back up to 90%. So you absolutely need that 3rd dose. One other bonus is that there are recent studies suggesting that people who have 3 doses in them have a lower, even if they get the virus, they have a lower viral load. They carry around less virus in their nasal passages and their oral passages. As a result of that, they are less likely to transmit it. So they're likely less contagious. So another bonus is that you're less likely to pass it on to other people if you're also triple vaccinated. But the most important reason is to protect yourself from severe disease.
And so related to that, Samir, there's a question in the chat. So would you say that a 4th dose is necessary?
It's a great question. We have a fact or fiction on it, so I might save it for that one. And I have that one, so yeah.
Great, excellent. Next slide. So even though I got infected with COVID-19, I still need to get 3 doses of a COVID vaccine to increase my protection against future infection. Is this fact or is it fiction? Option 1, it's fact. Option 2, it's fiction. Option 3, I don't know. So even though I got infected with COVID-19, I still need to get 3 doses. And we're going to close the poll. 78% fact, 11% fiction, 11% I don't know. And the answer, Anju?
So this is a fact. Now, it is true that getting COVID does provide some immunity, but the challenge is that this can vary from person to person. So we don't know how strong or how robust that immunity will be and how long that natural immunity will last. So there have been studies looking at people who have had the infection and have had the vaccine compared to people who have had just the infection, and you still get stronger immunity with what we call hybrid immunity, so the vaccine and the infection compared to natural immunity alone. So The answer is fact that you still need to get all 3 doses. It's just the timing of the dose after you've had COVID-19 is a little bit different. So as I said in the beginning, you would get your 3rd dose of the vaccine after your first 2 doses. If you've had COVID-19, you would wait 3 months for that timing and 6 months from the initial dose.
Great, thanks so much, Anju. Next question, fact or fiction? If I'm thinking of getting pregnant, or if I am pregnant, I shouldn't get vaccinated. Is this fact or fiction, or I don't know? So if I'm thinking of getting pregnant or I am pregnant, I shouldn't get vaccinated. And we'll close the poll. 90% fiction and 10% I don't know. Samir?
Absolutely right. Early in the pandemic, there was a lot of consternation. There was concern. This was a new vaccine. We didn't have a lot of data. At this point in time, and I should say early in the vaccine campaign, but at this point in time, we're well into our vaccine campaign and we have lots of data. Something that's really important for people to recognize is that we know that pregnant women don't do well when they get COVID disease. They have a higher risk of severe disease. So that's important because you're always thinking about risk benefit. The risk is much higher in pregnant women, not only to mom, but also to baby. There's about a 4 times higher chance of premature birth in pregnant women when they get COVID disease. So that's the context here, is that we already know there's a higher risk. At the same time, we now have studies showing that the vaccine mitigates that risk. Get the vaccine when you're pregnant, the risk to mom and the risk to baby gets reduced as a result of that vaccination. There's also a side benefit. Some studies show that there's passive immunity. So the baby actually gets antibodies from the mom. And there's some protection in the first few months, at least the first few months of life, as a result of those antibodies passed on from mom who was vaccinated. And that's an effect that's seen more so with vaccines than with natural infection. So vaccines seem to be more effective at protecting the fetus. The other thing is that we now have lots of women, pregnant women, who have been vaccinated. So lots made that decision before we had trial data. And so we have safety monitoring studies in several different countries that have looked at women who got the vaccine when pregnant versus those who didn't. And really no change, no difference was shown in birth outcomes for those 2 groups. Also, there's now a study, the biggest study I'm aware of, had looked at 40,000 pregnant women. And again, no effect on mom or on baby, no effect on preterm labor, no effect on birth abnormality. So really reassuring data. So with respect to safety of getting the vaccine when you're pregnant, I think that's quite clear now. In terms of fertility, because people also say, part of the question was thinking about getting pregnant. People are worried about their vaccine impact on fertility. Really no reason to think that there would be an impact on fertility, no biological or scientific reason to think so. But also we have studies. The biggest study I'm aware of is a study that followed 2,000 couples, looking at some couples had the male only vaccinated, some the female only, and some both vaccinated. Compared to couples who were completely unvaccinated, their chances of conceiving were exactly the same. There was even a study in women who were undergoing in vitro fertilization, and in those women who already had fertility issues, no differences in ovarian function in women who got vaccinated versus those who didn't. And for men, this becomes really important because COVID disease is actually associated with lower fertility rates, mostly because it's associated with erectile dysfunction. So there's more than 50 studies that show an association between COVID infection, COVID disease, and erectile dysfunction. So if you're worried about fertility, it's really not the vaccine that you need to worry about. It's the virus itself.
Excellent. And thanks so much, Samir. And you mentioned about the passive immunity in babies after the mom's been vaccinated. And can you mention again, how long does that last?
The study that I'm aware of found that a majority, like more than half of the babies still had antibodies 6 months after being at 6 months of age. So it's quite, several months later, not all babies, but more than half.
Okay, excellent, thank you. Next question. Since I have bad allergies or asthma, I should not get the COVID-19 vaccine. So if I have bad allergies and or asthma, I shouldn't get the COVID vaccine. Is this fact, fiction, or I don't know? So if everybody could vote now. And Samir and Anju, I'm sure that both of you have heard this many times in your careers as a respirologist. So this is a common thing that comes up, common question. So we're going to close the poll Fact, 8%, fiction, 85%, and I don't know, 8%. Anju, what's the real answer?
So the answer is fiction. So having asthma or allergies, whether that's to medications, food allergies, environmental allergies, it's still recommended that you get the vaccine. Now, the one exception to this is if you have an allergy to one of the components in the vaccine, like polyethylene glycol or polysorbate. In that case, it is recommended that you see an allergist first to be tested to confirm if you have an allergy. And often, even in that situation, allergists are able to sometimes come up with a different way to safely get the vaccine. For example, there's something called a graded administration of the vaccine if needed. But that's the only real sort of exception where you would see allergy. Otherwise, it is recommended that you get the vaccine with asthma or different allergies.
Excellent. Thanks, Anju. Next question. It's recommended that I get my COVID-19 vaccine as well as my flu shot. So is this fact, fiction, or I don't know? So it's recommended that I get my COVID-19 vaccines as well as my flu shot. Fact, fiction, or I don't know? And the poll says 93% said fact and 7% said I don't know. Samir, what's the answer to this one?
Yeah, get both vaccines. Neither, these are two completely different viruses. You guys know that. COVID vaccine will not protect you against flu. Flu vaccine will not protect you against COVID. Early in the pandemic, in the first fall of the pandemic, we were very worried about this twin-demic. You heard that term, that we were worried that we'd get hit by flu and get hit by SARS-CoV-2 at the same time and have a whole bunch of sick patients in hospital and overwhelm the healthcare system. We got a lot of patients with SARS-CoV-2, but we didn't get a lot of patients with flu. It was quite amazing, actually, 99% reduction in flu cases in Canada, and that was seen in the US and Australia and in all major countries that track flu. And that was the result of all the hard work we did. Distancing, hand washing, masks, all those precautions that we took. But what's happened now as we've relaxed those precautions is that flu has made a comeback. And so it becomes really important again to talk to our patients about getting their flu shot as well, not just talking about SARS-CoV-2 vaccination, but also getting their flu shot. And for children, for kids under 12, we generally do recommend a 2-week gap based on the NACI advice around that between those two shots. But for anybody who's 12 plus, they can get them at the same time. That's why God gave us, or Darwin gave us, 2 arms. You get one shot in one and the other in the other, and you're all set. So it's one visit, it's 2 vaccines. Absolutely, get them both.
Great, excellent. Thanks so much. Next slide. So at this point, the pop-up questionnaire has, you've all done fantastically well, and congratulations. And so we're going to move on from that piece to a more traditional kind of Q&A. Again, thank you, all of you. I know many of you submitted questions in advance, and we're going to go through those. But also wanted to flag that if you do have other questions that come up or that you think about as we're talking about this over the next few minutes, again, just want to encourage you to reach out. Colin actually has a follow-up question, Samir, to the rationale of the 2-week separation of vaccines in those under 12.
Yeah, so the rationale is that we know less about vaccination in that age group, SARS-CoV-2 vaccination. And I think what the NACI is trying to do is to just have an observation period, because if there is a side effect, you never want to be in a position where you don't know which of the 2 vaccines caused that side effect. So what they're just trying to do there is to make sure that if there is an emerging signal on anything in that age group, whereas we have billions and billions of adults around the world who've gotten the shot, but at least early when we started releasing it in that age group, it was based on smaller study data. So the idea was to get more observational data. That's why that delay is in there.
Great, excellent, thank you. And another question, are we still following the 3 months away from the 3rd vaccine dose to get the 4th dose? Anju, did you want to answer that one?
So this actually leads right into the next question about 4th doses, which Samir was going to talk about. I don't know if
Sure. So
go into that, yeah.
I mean, I know this question on fourth doses earlier, so we should just talk about it. I think that, so to answer your question, the timing of the fourth dose is 4 to 6 months after the third dose, and it depends on the conditions around you. If there's a lot of virus, which there is now, I would go with a shorter interval, like 4 months. The NACI says ideally 6 months, but it's, it really does depend on your risk. But how about just conceptually, what about a fourth dose? Do we need a fourth dose? People have heard about Omicron, and now they've started hearing about the subvariants of Omicron. BA1 was the first kind of what we called Omicron, which took over in December. But then we had a second wave with what's called BA2, which is a subvariant of Omicron that's about 30% more transmissible. And now people are hearing about, BA 2.1, 2.1, which is what's taking over in the US. And then there's BA 3 and 4 and 5 in South Africa. And so there's a lot of subvariants. And basically, we're climbing a ladder of contagiousness. It's getting more and more contagious. And this is where it becomes important to start thinking about fourth doses, because we're seeing a lot of burden of disease. We're seeing a lot of people get infected with increasingly transmissible variants. Rule of thumb is that it's a law of diminishing returns. Each shot you get is less important than the prior. So really important to get your primary series with 2 shots. We talked about the importance of a booster, particularly with Omicron. Less important than the second shot, but that third shot is really important. But now the fourth shot becomes even less important because you have such good protection from that primary series plus booster. The reality is that your protection after a third shot, just like we talked about after a second shot, does start to wane, and your protection against mild infection does wane quite quickly, several months after that third shot. But importantly, your protection against severe disease is sustained. And so for that reason, it really is, because the benefit is small, and there is a small benefit even for severe disease, it's most important to think about fourth doses in people who have a high risk to begin with. And that is a relatively smaller portion of the population than what we recommended third doses for, which is basically everyone over 12, and soon to be basically everyone. So for fourth doses, the idea is, what the NACI has said is, look, anybody who's over 80 and people who live in a congregate setting with a long-term care home, people who are in a high-risk environment. Certain provinces have used a little bit of a lower cutoff based on some data that suggests some benefit. And so in Ontario, that cutoff is over 60. Bottom line is, if you meet the criteria, if you're over 60, go out and get your fourth dose. But if you don't meet those criteria, don't fret, because your protection from 3 doses, particularly against severe disease, and that's what we care most about, remains very good.
Excellent, great. So, so we've answered that question. And let's see, the first recommendation was 3 months away for high-risk population in long-term care home. Is there any concern for those elderly who received their fourth dose following that first advice from public health?
No, I think, and it's a moving target, mostly based on community risk. So, at the time of the peak of the 6th wave, we were encouraging people who were a little bit more vulnerable, people who are immunocompromised. That's another category, by the way, that I didn't mention, that should also be considered high priority for fourth dose. We were worried about them in the context of how much community spread there was of this virus. The benefit of a prolonged dosing interval really is a stronger immune response. We learned that with our primary series, in that the first and second dose, the longer the period between those 2 doses, the stronger the immune response, and therefore the longer lasting the immune response. So we like spacing them out more because it's a longer lasting response, but we have to balance that against, well, then your protection's coming later. And if the risk is now, if we're in a 6th wave now, get your protection now. So there's no real concern in a shorter interval. It's always a trade-off between protection now versus longer lasting protection if you wait it out a bit.
Great, excellent. So moving on to the second question. So the next slide, this actually relates to one that's in the chat feature as well. So are we going to need to get an annual COVID-19 vaccine similar to the flu? Anju?
And so the short answer is we don't really know yet. Historically, we do know, as Samir and I have both been talking about, that vaccine protection does wane or decrease over time, but we usually know that boosters often offer longer protection than initial doses. We don't know if this is true yet for the COVID-19 vaccines, and what we're still learning is how many doses for the general population, not the high risk group, will be needed, and if the vaccines will be adjusted for future variants. So like everything in COVID, it is evolving, and we don't know the answer to this yet.
Great, thank you. Next question. Is it safe to mix vaccines? So we've been getting this a fair bit over the last year or so as well. Should I wait to get a certain type of vaccine for my next dose? Samir?
Yeah, this is really interesting because, at first it was more about, supplies. We didn't, you got a Pfizer, run out of Pfizer. So the advice was just get a Moderna. They're mRNA vaccines, they're similar, or it's people who got AstraZeneca. And then after a while, when we had enough mRNA supply and we knew it was a superior vaccine, we'd recommended mRNA and we told people to mix. Eventually, what got realized, actually through large studies, mostly through the UK, is that this so-called heterologous prime boost, which is when you boost with a different vaccine, in this case, usually it's 2 mRNA vaccines, so it's a slightly different vaccine, Moderna, Pfizer, or Pfizer, Moderna, you actually get a stronger antibody response. So it turns out the studies show that what was being done as a sort of stopgap because of supply issues is actually a superior approach. Because it's a little bit different, you get a stronger and more sustained antibody response. So I've gone from people shopping for Pfizer because they had Pfizer to now some people shopping for Moderna because they had Pfizer and they want to mix it up. But my advice is always the same, which is, the best vaccine is the one in your arm, in the sense that, it's the benefit is minor. It's so small that it's just not worth the hassle and the effort and mostly the delay of trying to look for a specific brand, a specific type of vaccine in order to mix and match. So definitely safe to mix and match, better in fact to mix and match, but trivial difference, marginal difference. So don't delay because you're looking for a specific brand or a specific vaccine. Go out and get whether it's your second or whether it's your third, go out and get the first one that's being made available to you. The exception being in people under 18, we generally would prefer Pfizer to Moderna because of side effect profile. But other than that, just go out and get the first one you can get.
Excellent, thank you. Question 4, should children aged 5 years and older get the vaccine? Samir?
Yes, really important. And I think it's important to recognize that children have a much lower risk of severe outcomes with SARS-CoV-2. And people, it's always about a risk-benefit calculus. And I think one of the problems, a little bit of misinformation that's out there is that it's only looking at one side of the equation. And that is that when everything is about balance, we talked about before. And so people are more worried about the vaccine than they are about COVID disease. And what we need to recognize is that even though it's low risk, it's not zero risk. A lot of kids have gotten this virus, and some of those kids have gotten sick. Some of those kids have died. Over 1,500 kids have died in the US. In Canada, we've done better, even proportionally. I think less than 40 kids have died, but that's still, 37 kids in Canada who have lost their lives to this virus. 6,000 kids were hospitalized for this virus in Canada, over 600 in the ICU. Kids can get sick. Kids can get specifically something called multisystem inflammatory syndrome, which is an inflammation of several different organs. You heard about it earlier in the pandemic. It could be very devastating. When you compare those risks, which are still relatively small, to the risk of the vaccine, again, the risk of the vaccine remains much lower in kids. And so that's where you have this risk benefit. And people talk about myocarditis, which is a risk in young adults, older teens, but the risk of myocarditis from COVID disease is many-fold higher than the risk of myocarditis in the vaccine. So it's always about that risk benefit and understanding what's on the other side of that ledger, which is the risk of COVID, which many, many children are getting, particularly now that we're back in school, particularly now that masks are not mandated in schools. Many children are getting this. Also, we've talked a little bit about long COVID. Kids can also get long COVID. Kids can get mild disease, but still have long-term symptoms from this virus. It can be very challenging for many, many children. We think it happens less than it happens in adults, but it still happens to a fair proportion of children. And if that's your child, your child is suffering. Your family is suffering through that, whether they get sick or whether they don't get sick, but then get long-term symptoms. So that's why in the balance of things, if you look at the risk-benefit ratio, it's clear that the benefit is in vaccinating children. And that's to say nothing about the impact on children being vectors. Children, even if they're only mildly symptomatic, being able to spread it to their teachers, to their parents, to their grandparents, to people who might be in their circle who are immunocompromised, and then perpetuating the pandemic in that way. So really important for us to be able to vaccinate kids from all of those points of view, to protect them, but also to protect from forward spread.
That's excellent.
That, if I might add, just as a Samir and I, being parents of young kids ourselves, the other thing is that you have to think about in kids is, you know, loss of school and time away. If they get like the other effects that COVID can have, if they do come down with the COVID virus and are ill from it, so those can have, you know, pretty profound mental health and other impacts on their education as well, for loss of school and time away from their peers and social interactions.
And I will say that all Anju's kids and my kid are fully vaccinated. So we practice what we preach. Yeah.
Excellent, thank you. And you talked about long COVID in kids. What are the common symptoms of long COVID? Like, what are the things that they're most seeing in the literature?
Yeah, long COVID is what we call it when people have symptoms for more than 4 weeks, and some people define it as more than 12 weeks after the initial infection. There's different types of symptom clusters, but often it's stuff like people lose their sense of taste and smell during the infection, and that can persist. It can also be neurologic stuff like headaches. Some people describe difficulty with concentration and memory. They call that brain fog. In some cases, it's very respiratory sounding stuff. Like people will get chest pain, they'll feel breathless. And in sometimes you do extensive testing, you'll find organ damage. There are many studies looking at long-term organ damage, even in patients with mild disease. But in many other cases, we do studies, and the studies that we have aren't able to show a cause. And so patients have very impactful symptoms. In many cases, they're not able to carry on with their day-to-day activities, with their work. It can have devastating impacts, but we're not always able to identify what the cause is. So this is something that's being studied. It's estimated to occur in 15 to 20% of adults, in that range, probably a smaller number in kids, but still it can happen in kids. And so really important to think about long COVID.
Excellent, thank you. So moving on to question 5. And just as a reminder to everybody, we've got about 5 more minutes. So if you've got any other questions that you want to ask before we wrap up, please post them in the chat or the Q&A. So question 5, are there vaccines available for those who refuse or can't take an mRNA vaccine? So if we just can't take it or we refuse, are there other vaccines? Samir?
Yeah, I'll try to be brief. So people know that we have the viral vector vaccines that we had earlier, the AZ vaccine and the Johnson & Johnson. Those are still available to people who can't get or won't get the mRNA. There are 2 more recently approved. One is the Novavax vaccine. That works a little bit differently. Again, it's the idea of getting the spike protein into your body for your immune system to then mount an immune response to it and form antibodies to it. They do it in a unique way. They actually use nanoparticles and directly kind of inject that spike protein into your body with the vaccine. And there's another one called Covafenz that's actually made by a Quebec pharmaceutical company called Medicago. That was very recently approved, and they use another totally different technology called virus-like particles. So both of these don't use mRNA platform, different technology. Both of them have recent trials showing that they're very effective at preventing symptomatic infection and preventing severe infection. So those would be other options. I don't think we'll need a lot of them in Canada because so many people have had mRNA vaccines, but for that small percentage of people who can't or won't, these are good options.
Great, excellent. So just in the interest of time, since we've got 5 minutes left, I'm going to move on to question 8. So, this is a question about treatment. So, because again, this is something that I know many of you have been reading about and hearing about. So what are the criteria for Paxlovid, so for COVID-19 treatment? Samir, can you give us an overview of that, please?
Sure. So really important for us as healthcare workers, number one is it's very effective. So in the study, it was nearly 90% effective in people with mild disease. It's not for severe disease, it's for mild disease early. It was 90% effective at preventing progression to severe disease. So really effective therapy, but it must be given in the first 5 days from symptom onset. And that creates pressure when your patient calls you and says, hey, I have symptoms, I've tested positive. You have to drop everything and try to get them Paxlovid within that first 5 days of symptom onset, because that's what's shown to be effective in that trial. The criteria for treatment were recently loosened in Ontario because we were very worried about running out of it, but then we were sitting on supply. And so right now, anybody, and it's only for adults, but any adult who has a weak immune system, who's immunocompromised because of inherent disease, because of medications they take, can get this drug. Anybody who's over 70 can get this drug. After that, it depends on vaccine status. So people who are not fully vaccinated, anybody who's 60 who's not fully vaccinated, 60 plus, can also get it. Anybody 18 plus who's not fully vaccinated can also get it if they have a chronic condition. And there's a list of chronic conditions, and I think we'll put out the, hopefully we'll be able to send the link on eligibility criteria, because there's a whole bunch of chronic conditions for 18 plus not fully vaccinated people that would qualify them. But you kind of have to look for that. But the main thing is move fast. If you're aware of somebody who's symptomatic, they've got to be tested positive on a RAT or a PCR. And the second is that there are lots of drug interactions, so you have to review their drugs before you make the prescription.
Great, excellent, thank you. And then the last question then, question 9. So Anju, over to you. What's your advice to somebody who's on the fence about getting vaccinated for COVID?
So the first thing I would say, it's always good to create spaces like this, safe spaces where someone has the ability to talk and ask questions freely, because when I hear someone's on the fence, I really like to know what that means to that person. For some people, it's a matter of booking, or they don't want to wait, or they don't understand the importance of getting the first, second, or third dose. Sometimes it's fear or misinformation, and sometimes people just need to really hear the information in a different form, like a video or another infographic, or just hear it over and over again. So what I would sort of do is talk to somebody, if they're a family member, a friend, or patient or community member, also direct them to resources, maybe role models that they would trust in their community, whether that's faith leaders or community leaders. So many different organizations, a list of which will be shared at the end, have put out very simple videos or infographics by various different leaders and from all walks of life that might, help motivate people for their fears, and also talk about their process of getting the vaccine. So that would be my advice.
Great. Excellent, thank you. And just the final in the last couple of minutes, Anju, any last comments, suggestions, advice for people?
So, the last few seconds, I would just say that vaccines are safe. We have billions of people worldwide who have had the vaccine, many people worldwide who are still really eagerly waiting to get their vaccines. So I hope that everyone leaves this chat with some resources and answers to some of the questions to help themselves or others in their community to be encouraged to get their 3 doses.
Great, thanks. Samir, any final words?
Final thought is just that, is just to be positive in the sense that we've come so far. And we're in so much better a place than we were 2 years ago as a society, as a healthcare system, in dealing with this virus. So I'm very optimistic about the future. Excellent.
Thank you. And so in terms of next steps, we wanted to get your feedback on the session. And so there'll be a survey link in the chat box that'll appear shortly. And we ask you to please complete the survey. As those of you who participated in these sessions before, you know that what you say kind of drives the next sessions and what evolves. So just wanted to thank you in advance for completing that. We will email a follow-up and provide you with the link to the slide deck as well and the recording. And then also some of the resources that we talked about. And we also mentioned that we will provide the references that we talked about to over the session today, but those will all be provided as well. If you're interested in kind of, hearing more about the Wellness Hub, if you haven't had a chance to look at the website yet, we would encourage you to look at that. We would also encourage you to think about whether or not you're interested in participating in any future events. And then we'll also in the slide deck include some information about some of the other components of the studies, including one that's going on right now. Many of you, again, are participating in it as well, around an implementation of rapid antigen testing in congregate settings as well to help manage with outbreaks too. So, and it's one that actually tests, and what we were talking about, it tests for COVID as well as influenza. So there'll be information for that in the slide deck. Having said that, thank you all very, very much for joining us. Thanks for sending your questions in advance. Thanks to the Wellness Hub group for preparing everything, including Hannah and team. And most of all, thank you so, so much to the amazing Dr. Anju Anand and the equally fantastic Dr. Samir Gupta. We really appreciate you sharing your knowledge and your expertise with us. Thanks, everybody. Please stay safe. And if there's other questions that come up afterwards, always feel free to reach out. Thank you, everybody. Take care and have a good night.